I was sitting here and I was like, how did I end up in the same shirt that I did a video in yesterday? And then I was like, looking at the video and I was like, was it yesterday? Maybe it was the day before. I don't remember. I was like, oh, I did that video in my pajamas. And I'm in my pajamas again. I'm a tank top hoarder. I am. I have this shirt in double. Every tank top I own, I bought 2 of them at once. 2 of this exact same kind. So don't ask me why. I'm just weird. Okay. So I'm trying to figure out how I want to start this. Okay, so the doctor's is Tuesday. So, you know, the doctor's appointment is Tuesday. Everybody knows that. I don't know why I keep repeating that. What is wrong with me? Okay. I'm not stressed. I'm a little curious on what they're going to say. I'm at a pregnancy test. I've taken so many, I'm completely out and I'm not buying anymore. Anyway, it's 11:16 p.m. my time. Today is June 3rd. I'm sorry, it's 11:16. I have 46 minutes to get my period. To have my period. 46 minutes for it to come. I don't have a single sign. Like I've stated before, my period has never just shown up after the 3rd, and if it does, I'm going to be very surprised, to be honest. I don't think it's coming. And I know that's like, everybody's like, oh, why? Why don't you think that? I don't think it's coming. I really don't. I don't believe it's coming. I don't believe I'm going to have a period. I don't believe it's scheduled to come, to be honest. And I know that seems odd, and I get that, but I have been completely regular. Like completely regular since last July, except for that 1 month in March that I did not have a period. But even the Provera that I took for the 5 days, because it was 5 days, 2 pills a day, I took that on March 15th. What is wrong with me? And they said to give your period 14 days, okay? 14 days came and went, still nothing. I got my period exactly on April 3rd. No, April 2nd was that month, and then May 3rd. So, I mean, even though I skipped that month, my period still came on the 2nd, and then the 3rd, and then here we are, June 3rd, and there's nothing. Like, I'm preparing for war. I'm like, oh God, it's going to be painful. Oh God, this is going to suck. Nothing. I don't know what my test results are, and that's what's driving me nuts about all of this. Is the fact that I don't know what my test results are. I do know this. If my period is not here by Tuesday at 10 a.m., I'm going to have to tell her that I'm a few days late, and then I'm going to have to give her the history. And then she's going to tell me to strip. Or she's going to take me into the next room, and she's going to tell me to strip from the waist down. And then she's going to give me the damn wand. And I hate the wand. Seriously hate the wand. And then, when that's over with, she's going to send me all the way down to the hospital to get more blood work done. And then I'm going to have to schedule another freaking appointment. Then, if my period still hasn't come between that time that the new appointment is, I get to take Provera. Unless, you know, well, actually what it'll be is I'll go back in on Thursday for the appointment. And then I'll take my Provera, and then she'll give me the next round of Clomid. Is exactly how it's going to be. My doctor is not the type of doctor who will just do blood work only, even if it's just only been 2 weeks since I've had blood work done. She is the type of doctor who wants it done the exact same day that I come in. That's how she feels. Like, last time we did the Provera and we did the ultrasound, she was like, I don't want to miss anything. I don't want it to be where you're like, you know, a week pregnant and I give you this and you miscarry. I don't want to miss anything. And I was like, well, I'm really happy you feel that way, because a lot of doctors don't feel that way. And I mean, I learned that with my daughter. A lot of doctors just don't feel that way, to be honest. And it's very frustrating that they don't. I don't feel so stressed out over what's coming, and I feel let down about the pregnancy thing, but it's okay. And I know that all of that should not be affecting my period. And even though, like, if some people are like, oh, well, all that could be affecting it, that's not what's affecting my period. No way. I mean, I am so used to high levels of stress that this is nothing compared to what it could be. It's just another month that I guess I'm not going to cycle. And either I'm not cycling because somewhere along the line I am actually pregnant and that none of us just know it, or my body decided not to cycle this month. But I'll be honest with you. This isn't normal. Not for me. This is not normal for me. This is really out of the comfort zone, to be honest. Yeah, I have cycling problems. I mean, most women with PCOS, they have these problems 24/7. But this is the odd part about this. When I have cycling issues, normally it's like I don't cycle for 6 months, and then I cycle for 3 months, and then I don't cycle for 6 months. Now, to be normal from July to now, except for in March, is, sometimes that does happen for me, especially since I lost a ton of weight. Normally that does happen for me. I have never, not once, have I gone normal from July of 2011 to March. What is that? So that's 5, 6, 7 months. Not cycled for March, turned around and cycled for 2 months, and then not cycled again. That's not, like, I can literally go back through my entire period history, and that has never happened. Not once. So, I mean, I'm sitting here and I'm like, what the hell is going on? Plus, on top of it, I have acid reflux. My boobs were sore for a day, but then they quit. And I don't know if it was just because, like I had a dog jump on me or what. So really that doesn't count. I'm having a little bit of weight gain, but not like a lot of weight gain, it turns out. My phone is dying. My stomach is only rounding out at night. Not during the day, not any other time. Just at night. During the day, my stomach is fine. At night, it rounds out. This could be a cyst, or it could possibly be something else. Not really too sure, to be honest. What else was there? I'm nauseous. I'm dizzy a lot. I'm overly tired. I was craving tuna fish. Been craving cinnamon rolls, which I made some. And I'm craving something sweet, but not like too sweet. I can't explain it, to be honest. Like, there's like a craving inside my head, but I just can't figure out what craving it is. Mostly it's just the acid reflux. Like, it's really, seriously, the acid reflux. Like, my Tums are sitting right here next to me, and I'm having acid reflux a lot lately. And my friend was like, oh, was it your gallbladder? And I was like, I don't have a gallbladder. I had my gallbladder removed, let's see, 12, 13, 14 months ago. Don't have a gallbladder. Haven't been eating bad to get that. Normally, I get acid reflux if I drink like Pepsi and something. Pepsi gives it to me, but I haven't been drinking Pepsi. Like, literally, the last few days, I've had a few Dr. Peppers, but not like a ton of Dr. Peppers, which is odd because normally, like, I can always drink a ton of Dr. Peppers and no acid reflux. But, like, I've been having acid reflux with water and lemonade, and that's really odd because normally I can drink that and never have acid reflux. And my eating is not different than how normally it has been. I mean, it really is not different enough to give me acid reflux. So I'm really kind of scared because I started taking these stackers. And I'm not going to take any more until I know what's going on. And I've been on stackers before, and stackers have never given me acid reflux. So, yeah. I really don't know what is going on, to be honest. I don't understand. Like, normally I can pinpoint certain things and I understand my body. But I don't understand this. I mean, I'm sitting here and I'm like, where is my period? Where is that sharp pain? What is going on? And then I was thinking back to myself, I wonder if I did ovulate late in May. I wonder if I did. I mean, and then I was thinking, I wonder if she's testing me for ovulation too early, because my period, it turns out, like, I've been doing the math, are like anywhere between 28 to 30-day cycles. And it's saying that I should have ovulation anywhere between the 22nd to the 27th. So I'm just so confused by all of it. And I'm wondering if I did ovulate, and did I ovulate, and am I pregnant, or is it something else? So is there a cyst? What is going on? Why am I not having a period? I mean, I know that women with PCOS are prone not to have periods, but this right here is so not normal for me. And I mean, it's not like magically my body is going to say, oh, well, we're going to change everything. I mean, yeah, it changes things, but this is a major change for me. Honestly, for me, this is a major change. I really don't know what's going on, and it's very frustrating, but I really don't think my period is coming. I really don't. And I know when I get in there, and if I don't have a period, she's going to be like, well, you're only 2 days late. And I'm going to be like, I'm never just 2 days late. If I'm only 2 days late, that means I'm going to be 2 weeks late, which means I'm going to be a month late. That's exactly how my body works. I know my body better than the doctor knows my body. I know my body better than anyone else knows my body. I know that when something is not right. I've been doing this long enough to know my body. It's really frustrating, because I know that all of this in the long run is to get to goal. And I mean, there's certain goals I have, to lose the weight and to have a child, which either one comes first, to be honest. Though I really, 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 really would prefer to have that child than lose weight. And I'm doing all this to get to goal. I'm doing all of this to have a baby. I'm putting myself through all of this to have a baby. It's so stressful. Like last night, I was to the point to where I was just like, fuck it, let's just cut my ovaries out. Cut my ovaries out. Let's call quits. I'm done. Please, I'm done. I can't do it anymore. And then I cried. And then I got my husband incredibly wasted and took advantage of him. This just... Everybody is like, oh, well, you know, it took you so long to get pregnant with your daughter. Maybe that's just how it works. And I'm like, technically, it only took me 17 months to get pregnant with Lily, if I remember correctly. 17 months. And I'm thinking, Lily is not 17 months old. Lily will be 4 years old on Halloween. I have not been pregnant in almost 4 years. 4 years I've been doing this. 4 years that I have followed all of the doctor's instructions. I have done weight loss things. I've done dieting. I've done every single diet that they've put me on. I've had gallbladder surgery. I've exercised. I've cried. 4 years of this. How much more am I supposed to do? I mean, it's like I don't work. It's like everything's broken. And then there's a part of me inside my head, and I know this is going to sound crazy, that is like, I wonder if they tied my tubes. And I mean, you know, the doctor did give me the wand ultrasound to check, but I think that if she was checking and looking at all my ovaries and doing all of that, she would have seen if my tubes were tied. At least I would have think she would have seen that. And the only reason I even say any of that is because my daughter's birth was so freaking bad that, like, the hospital lied about so much, and there were so many problems with my doctor and her birth that, oh, you could just, I don't even know what's happened, like what could have happened. I don't know what to do. All I know is I can't wait for Tuesday to get here. I can't wait to go through this. I can't wait for this to be over. There's a part of me that's like, maybe she'll tell me, you're pregnant. And that's why, but there's another part of me that's like, don't be a dumbass. Don't get your hopes up. But I'm late. And I even asked my friend, I go, can we just say I'm late now? I've got like now 30 minutes left and still nothing, no signs, nothing. And she goes,